Hi everyone, I'm Lauren Misik, and we're going to be doing an overview of the Swedish healthcare system. Sweden has a population of about 10.6 million people. Interestingly, Sweden does not collect data on race and ethnicity. Instead, national statistics rely on citizenship and country of birth, which gives us a sense of Sweden's growing diversity. Like much of Europe and similar to the US, Sweden is experiencing an aging population. Birth rates have been relatively low and death rates have been slowly increasing. This demographic shift is important because it places increasing pressure on healthcare resources, long-term care, and the workforce. Sweden is also a highly immigrant-friendly nation. The largest immigrant groups come from countries such as Syria, Iraq, Finland, and Poland. This diversity introduces additional healthcare needs, including chronic disease management and mental health services for newer immigrant populations. Sweden's healthcare system is decentralized but with strong national oversight. The national government is responsible for regulating the system, setting overall policy, and supervising quality, safety, and cost effectiveness. The real operational responsibility lies within Sweden's 21 regions. These regions finance, organize, and deliver most healthcare services. They decide budgets, run hospitals, and set reimbursement rates. Municipalities handle services that are closer to daily living, including elderly care, disability services, school health, and public health education. This separation can sometimes cause coordination issues, but overall it allows Sweden to tailor services regionally while still maintaining national standards. Sweden's life expectancy is one of the highest in the European Union at 83.1 years. Sweden also has one of the lowest infant mortality rates in Europe. However, not all indicators are perfect. Sweden's suicide rate is higher than the OECD average, which has prompted ongoing investments in mental health initiatives. For causes of death, cancer and cardiovascular diseases are the two major contributors, similar to other high-income countries. Sweden's healthcare spending is moderate compared with other high-income nations. In 2023, Sweden spent 11.2% of its GDP on healthcare, slightly above the year before. Sweden is known for its efficiency in its healthcare system. For example, Swedes have fewer annual doctor visits than the OECD average. There's been a long-term push towards primary care and outpatient treatment with fewer inpatient surgeries and shorter hospital stays. Utilization varies by region and by income, with lower income individuals tending to use more inpatient care and less preventive or specialist care. In terms of where the money goes, Sweden spends relatively less on inpatient care than other OECD countries, largely because of its emphasis on primary care and prevention. Sweden provides universal healthcare coverage, funded primarily through taxation. All legal residents, including immigrants, are covered. Undocumented children receive free care. Undocumented adults can receive urgent care, though without subsidies. Patients pay very small out-of-pocket costs. Co-payments exist, but they are capped annually, which makes catastrophic health costs extremely rare. Employer-sponsored insurance plays almost no role, although some employers offer supplementary private insurance that allows faster access to elective or specialist services. This supplementary insurance is growing but remains a small part of the system. Sweden does not operate as a market-based healthcare system. Primary care is provided by general practitioners in publicly owned health centers, and these centers act as the gateway for referrals to specialists. Hospitals are publicly owned and organized by regions. They operate under global budgets with some use of diagnosis-related groups. Preventive care is a major focus. Sweden invests heavily in cancer screening programs, vaccination programs, public health campaigns, and workplace wellness initiatives. Private equity plays only a limited role, mostly in health technology or specialized clinics, but the overall system remains strongly public. Payment models depend on the type of care. Primary care uses mainly capitation. supplemented by small fee-for-service components or performance bonuses. Hospitals rely heavily on global budgets, with decreasing use of diagnosis-related groups. Specialists follow a similar budget-based model. Unions representing nurses and physicians have recently expressed concern that funding is not keeping pace with rising staffing and service costs. Pharmaceuticals are tightly regulated in Sweden. The agency TLV evaluates whether medications are cost-effective and decides what gets reimbursed. Sweden actively uses QALYs, typically valuing them between 20,000 to 50,000 kronor, with more flexibility for severe or rare conditions. Generics dominate the market. 90% of dispensed medications are generic, and pharmacists are required to substitute the cheapest equivalent. Regulation is a multi-agency effort, covering pharmaceuticals, medical devices, and healthcare quality. Sweden is considered one of the strictest countries in using cost-effective analysis, influencing everything from drug approvals to coverage of new technologies. Despite its strong social welfare system, Sweden still has notable health disparities. Rural regions have fewer providers and longer wait times. Lower income residents have about 5 fewer years of life expectancy compared with high income groups. Immigrant populations experience higher rates of diabetes, obesity, and mental health conditions. Sweden attempts to soften these disparities with strong social supports: free school meals, housing assistance, rent control, early childhood education, and school-based mental health programs. Sweden faces significant workforce shortages, especially in nursing, primary care, and specialty medicine. Many nurses leave for higher paying jobs in neighboring Norway, and some clinicians are leaving the public sector for private facilities. To address these gaps, Sweden is expanding residency positions and exploring streamlined pathways for foreign trained physicians. Biggest challenges moving forward include long wait lists, workforce shortages, an aging population. To improve access, Sweden has allocated new funding aimed at expanding capacity and reducing wait times. One recent reform matches patients with available providers across regional lines, allowing people to receive care faster even if the closest provider is fully booked. So in summary, Sweden has a publicly funded healthcare system, which so far has shown good health outcomes for money invested, although the system itself is not perfect and health disparities still exist. And many of the same challenges still exist in Sweden that we experience in the United States, although some of the financial problems do not.